Hi, Dan Zatarski here from MD Custom RX. I am with my new friend, Dr. InJun from Reveal Wellness in Oconomowoc. We are here today to talk about essentially de-prescribing medication.
Yes.
So what can you tell me about NSAIDs and what you're seeing from patients that are coming into your clinic that have joint pain? How do you approach that with that patient?
Well, it's a great question. I'm glad that we did. First off, I'm glad that you and I met, because I think we're going to help a lot of people here in Lake Country that are suffering unnecessarily with joint pain. And, we're able to use your technology, your facilities, and your products to help reduce the systemic inflammation. I'm using my technology to reduce and help really regenerate the localized area they're coming in with. So I use a Shockwave device. I use a focused electromagnetic Shockwave device as a diagnostic tool that I can scan the joints they're having pain with to figure out what is the cause of the pain. Because oftentimes people are treating the effects and not really getting the cause, the problems they're having, and the symptoms sometimes are misleading. So I'll scan those areas to figure out where the damage is at, to see and really qualify them or disqualify them for using the device or any other technologies that we use with the regenerative medicine. So whether it's PRP, exosomes, or wart and jelly stem cells that we combine then with the Shockwave device, or even red light therapy. So oftentimes we figure out, first off, if they qualify or disqualify with the technology I have, and then talk to them about what else is going on in their life. Because oftentimes they're coming because they've been using some sort of prescription medication for pain or an NSAID or something like that, that's actually caused things to get worse. And the next thing you know, they're on all kinds of other drugs on top of that, right? And you're probably seeing that in your world too.
Way too much. Yep. They'll come in for a pain medication, and then lo and behold, they've got an ulcer from an NSAID. Then they're on some type of antacid. And then from there, kind of spirals. A lot of those NSAIDs have side effects that then, what we're seeing then, their health starts to deteriorate.
Yeah.
Then now they're on 2 medications. Now they might be on a 3rd. Now they're feeling really crummy. They might, mental health starts to creep in, depression, low mood. So if we can identify the root cause of that problem for that patient, their pain and their inflammation, I think that's a much better approach to take. Would you agree with that?
Yeah, it helps enhance their quality of life as well. If we can keep people moving, that's really the really truly thing of life is motion, right? So keep them moving, and then all of a sudden things start changing for them, right? Because you've seen so many people going down, like you said, the pain pill path, and next thing you know, they're on antidepressant drugs.
Can you explain a little bit when you did the Shockwave on me? Previously, I did Shockwave therapy on a shoulder, some scar tissue that I had. What's different about your machine?
Yeah, so the other device that you'd use that you're explaining to me is electrohydraulic device, where it's an unfocused device. The one that I'm using is a focused device, is electromagnetic. So as you know, all of our cells have a positive and negative charge. And the particular device that I use is different in the fact that it's more specific and isolated, and I can also penetrate a little deeper. What that means is you have to be more precise on what you're activating to utilize the Shockwave device to get the results we're trying to give the patient.
It's fascinating because I always think of it like the machine that was used on me earlier was more of a shotgun approach, where yours is very much, like a precision rifle, right?
That's a great analogy.
Very targeted.
Absolutely. And I've used that other device that you spoke of earlier as well. And they're both great devices. They just approach the situation a little differently.
Okay. So really it's getting, again, to that root cause of that inflammation, getting that systemic inflammation down, which I think is really going to help your therapy and the tools that you have at your clinic.
Every single time when there's a systemic inflammation, and here in Wisconsin, unfortunately, people here do not like to give up their alcohol. And that does cause a lot of cellular inflammation, because at the end of the day, we're really trying to help the cells, whether it's systemic or it's localized with a joint per se. If the cells are dysfunctional, the body is not able to do what it's designed to do. We have to flush out the toxins and bring in the nutrients. And if we can't do that, the body's not going to function what it's supposed to. It doesn't matter if you eat well. It doesn't matter if you're doing all these wonderful things for lifestyle. If those cells aren't getting what they need to be able to replenish and regenerate, that person will keep chasing their tail, and they'll never get to really the quality of life that they're really pursuing, or the longevity they're pursuing.
So really what I'm hearing then is, again, to reiterate, is just to get to the root cause of the problem, get that patient's inflammation down both systemically, so it can help more of an acute issue.
Correct.
Right? And then ultimately just maximizing their health, because if their pain goes away, right, their mental health is going to improve, their whole entire mood is going to improve. And that's ultimately, they're not going to be in that normal range. They're going to be in that, what I call optimal range.
Yeah.
Right. Everyone normal, like you were saying before, is like your normal is sick all the time.
Yeah, a sick population.
Yeah. So let's try to shift the paradigm. We're not going to be sick anymore. We're going to optimize our health.
Yeah.
Not just limp along.
Well, that's what's exciting about this collaboration here in this relationship is I can then hand over those patients that are having some systemic things going on, and that will help me with the localized area I'm working on. Because oftentimes when that systemic inflammation goes down, that localized inflammation goes down as well. So that means that joint pain reduces as well. So it's a synergistic relationship that most people don't put together. And when we start to do that, now we have the truest solution for them for long-standing outcomes.
Yep. Excellent. Well, I look forward to working with you in the future. This is fantastic.
Great. Thanks. Appreciate your time.